Dr. Isloor, good
Hi,
evening.
hi, Mrs. Priya. Good evening. How are you?
Very well. It's such a pleasure to have you here today. Uh, we are in the middle of a terrible situation in the country and globally.
I know.
We've got
I know.
COVID issue, we've got a lockdown, we're all stranded
Yeah.
in homes, and we all have to be good citizens. But Dr. Isloor, we also have
Yes.
to be good pet parents. And we also have to be
Very true.
responsible towards our animals and towards all the voiceless beings that are depending on us. Now, I
Very
am
true.
so grateful that you, being such a well-known, globally renowned, of course, nationally renowned virologist, a person who's specialist in, a person from the veterinary background, but more of an academic right now. I'm so delighted to have you, on the phone and talking to us about some of the specific concerns that we are having on this situation with animals. So, if I can just ask you to tell us a little bit about your, what you do right now. And along with that, I'm going to post the first question to you as what do you think that is happening with all this news? You saw the article this morning in Deccan Herald, you saw some of the articles that you've been quoted in. What do you think,
Yeah.
in the current COVID situation, on pet
Yeah.
abandonment and the current COVID situation, which has got so much of lack of information or wrong information. What do you think about the current pet abandonment issue, Dr. Isloor?
Yeah. Mrs. Priya, this is more than shocking to me
Yeah,
to go through today's Deccan Herald, as you rightly said,
yeah,
that out of a panicky situation, our pet owners are actually abandoning their pet animals. So
yes,
dogs and cats are let out, and it was more than shocking, to tell you very frankly. And this is nothing less than rubbish and nonsense that out of this kind of situation, they are abandoning their pets. Are we abandoning our family members in such kind of situation? Do we do
absolutely,
that?
absolutely,
Never.
yeah,
Yeah, absolutely. There is no need to be, say, having this kind of, say, panicky situation that is actually leading our pet owners to abandon their own pet animals.
right,
Yeah, they see. You see, nowadays these pet owners, anyway, these owners, they are considering their pet animals no less than their family members. How could they resort to this kind of say situation? This is very surprising. This is nothing less than shocking to me. And
absolutely,
at the global level itself, Mrs. Priya, there is not even a single laboratory-based evidence to prove that this COVID-19 virus, which is actually known as SARS coronavirus 2, SARS coronavirus 1 refers to the one that was responsible for the outbreak of SARS way back in 2002,
that's
almost 18 to 19 years over. And there is not even a single laboratory-based evidence to prove that there is a transmission of this virus from pet animals to human beings. You see, if you go through the data,
yeah,
as of today, more than 1.6 million, that means more than 16 lakh people have been confirmed to be infected,
right.
not suffering. So, but not even a single episode of transmission of virus from animals to human beings. They're all because of human to human fast spread of this viral infection.
And this is actually very shocking that there are two aspects to it. One is what is we are being told that stay away from other people, humans, dogs, whatever. We've been told stay away. That's one aspect. So that is scaring a lot of people. The second
Yeah,
aspect is we are being told a lot of vague information about dogs and cats in China and some in Hong Kong and
yeah,
over
yeah,
here. And the fact that the origins of the disease was zoonotic, because of bats is what we hear.
yeah, because basically,
Yes, so the origins, and then our own fear. So the third thing is that we're getting a lot of bits and bytes of information that we're not able to process, which is, the Bronx tiger got COVID. That some misinformation comes on.
one cat in Belgium and then two dogs in Hong Kong.
Yes, and
Yeah,
then you get this tiger, then you get some bits of information. So the assumption is animals can transmit COVID. But if at all, if there's anything, it's the other way around. The animals are not transmitting to us. We are transmitting to the animals. So we have
100%,
to keep them
precisely,
safe. Yeah, not the other
true,
way around. And we cannot
exactly.
abandon our animals. And our government should do a lot more in putting this across clearly. Because if you don't, Dr. Sloor, we're going to have a pandemic of abandoned animals on the road, causing more of a health hazard, causing
Yeah,
pressure on the system, and creating territorial
exactly.
fights. Yes. So, what is your so as a concerned person in animal welfare, as a person who is a pet parent myself, I mean, it's very important for me to look at these three issues: pet abandonment, lack of knowledge, origins of this disease, and the fact that a lot of misleading and bits and pieces of information are available, which is causing us a nuisance. Help us
Yeah.
understand help us understand the scientific basis for this, because you have so much of knowledge. You're an expert in this space. The second thing is you've done so much of research, practically a second PhD in COVID itself right now. So your
Oh,
thoughts would be very, very much appreciated, Dr. Isur.
yeah, as you said rightly, Mrs. Priya, as far as the Hong Kong episode is concerned, it is actually proven that these two dogs, the first one was actually a 17-year-old Pomeranian, and then the second dog was actually GSD.
Yeah.
And it is confirmed based on laboratory evidence that they have in fact picked up the infection from the deceased owners.
Uh,
The patients, their pet owners, they themselves were actually confirmed to be infected with this SARS coronavirus 2, and then the same virus was actually isolated from their samples, number
right,
one.
right.
Then coming to the Belgian cat, there also it was actually proven based on the laboratory evidence that it actually picked up the infection from its owner. So
Hmm.
then coming to this Bronx Zoo episode of that Nadia, that's actually
Mhm.
Malayan tiger, that was actually reported to have picked up infection from the employee in the zoo itself. So there is only one-way transmission as of now, whatever we know at the global level itself. So as I already mentioned, there is not even a single report, Mrs. Priya, of a transmission of this virus from pet animals to the human beings. So keeping this in the background, absolutely there is no need for our pet owners to be panicky about this situation, then resorting to this kind of very bad practice of letting them out and then abandoning them and then creating all this kind of situation. That is my personal view. They need not have to be worrying at all. And then only thing, say based on again whatever this British Veterinary Association, they have given the advisories, then American Veterinary Medical Association, the veterinarians in the US as well in the UK, they have also given advisories to their say pet animal owners and then general public not to resort to this kind of a panicky situation. Absolutely, there is no need of transmission of a virus from pet animals to the human beings based on whatever the literature is available, based on whatever the laboratory evidence has been generated at the global level.
Yeah.
At the most, if someone is having that kind of, say, the confusion or the concern, let them keep their say, pet animals indoor itself. Keep them watching. That's enough. That is the maximum possible thing that they can do. Then as far as other say pet practitioners association are concerned, I want them to again say educate their say clients. The pet animal owners will have to be educated, and that there has to be more and more of such extension related activities, bring a kind of awareness among our pet animals. And I wish we should be able to do that through this particular say session, Priya.
Thank you so much, because I agree with you on one thing, that we have a role to play, and as a country we have shown constantly our leadership, our compassion, and I hope on this factor also, because of lack of information or because of fear, that we
Exactly.
do
It
not
is just
make any mistakes which are so tragic for our pets and for animals in general. Do you have any?
very true.
Yeah. And it makes me feel also very much more what is the word for it, much more comfortable and extremely much more confident, because when an expert like you confirms what we have already been hearing about, and you're doing this right here in Bangalore, it gives us a very strong faith and a base. But what do you think is your message to two stakeholders? One is, what do you think the government should do? And if you had to say one thing to pet parents and or people who are scared of animals, what would be that? So first, let me ask you, what would you tell the government to do? I feel they have a role, Dr. Isloor. They must send out a
Exactly.
circular that please don't do this. And we all know that if you abandon an animal, there's a 3-month imprisonment or 3,000 rupee fine or both. Yet people are being
Exactly.
excited to do it. Yeah. So what do you think the government should?
Exactly. See, my message would be very, very clear, Priya, at this particular juncture. I would be happy and I would be, say, giving some kind of suggestion to the government, maybe the federal government, the central government, as well as the state government, to pass on this kind of message to the general public, the pet owners, and so also maybe the livestock owners. Maybe they also could resort to this kind of, say, panicky situation. We don't know about it.
Hmm.
And it will have to happen through the animal husbandry department, and then we have several NGOs, and then we have Pet Practitioners Association is also there. PPAK is also there in
Yeah.
Karnataka.
Yeah.
Through these agencies, and then there are several NGOs which are already functioning in this say, livestock sector as well as the pet animals, especially in the cities like Bangalore.
Yes.
I expect the government sector to pass on this message to the general public, the pet animal owners, not to resort to this kind of a panicky situation, and then prove that there is no single episode of occurrence of COVID-19 in case of human beings through the pet animals. Absolutely, there is no, and this is scientifically proven. As far as the day's context is concerned, this kind of message will have to be conveyed to the pet animal owners through the NGOs, then the animal husbandry departments. I think
Uh,
that should really take care of the situation.
I agree. I think that would be
Yeah, bring these
fantastic.
people, bring these pet animal owners
Mm.
out of this kind of a fear and then panic situation. I think it is only the kind of awareness that we need to bring. That is where the government will have to play a major role. The way they have been giving this kind of advisories to the human population. The similar strategy could be employed even to increase the awareness of our pet animal owners. That should really take care of the situation to significant extent. That is my personal feeling.
I want to, just share with you, just yesterday, there was an incident in, I think it is Electronic City, where a person
Okay.
was asked to leave their rented premises because they had a dog. And secondly, the landlord, who's a
Oh,
lawyer, by the way, was, there was a mother and pup, which was outside the house, not harming anybody, all, vaccinated, everything. They tried
oh
to put
no.
the dog and the puppy into a gunny bag and relocate her. So, of course, we got involved and we tried to communicate. We got the,
Manage the
somebody,
situation.
yeah, to help.
Yeah.
But I can convince maybe pet parents who already have love for animals, but people who don't like animals, it's even worse because they're actually threatening. So, don't you think we should have some kind of a legal base or some kind of a strong, penalty, which is already existing, but should we not enforce that?
Yeah, exactly. Very similar say, enforcement will have to be say implemented even in case of animal health sector. I agree with you. See, so a lot of legal implications are being implemented for this COVID-19 situation in human beings. Why not we have the similar situation even in case of pet animals? So
Absolutely.
it is apt and it is timely that we have to have it.
Absolutely. No, I completely agree with you.
Yes,
And I'm going to,
I totally endorse whatever you said.
yeah, no, I want to thank you because this was just an unexpected and a happy conversation because having an expert like you, Dr. Isloor, just makes this so much more base of confidence for us. But before I end, I just want you to share a little bit about what you do, and I would also, before that, summarize our discussion has been about what do you think about the current COVID situation and its impact on animals, particularly pet animals, on the issues of abandonment, what is the basis of that opinion, which you've also shared with us, your message to the government to take strong steps, to pet parents to be conversant, cognizant, and knowledgeable about
Exactly.
this, to the general population not to put pressure on people with animals or with dogs, animal husbandry
Yeah,
department to take the right steps when it comes to all animals, whether it's livestock or pets, to treat them properly
exactly.
so that there is no
Yeah,
discrimination and
exactly.
cruelty to animals because of that. This is what you have confirmed during this discussion. And as a
Yeah,
virologist,
this is what precisely I endorse what you said. Yes,
so you,
that's important that we have to have this kind of say implementations to make our pet animals, pet animal owners feel comfortable, and they need not have to be worrying about and then think and go on imagining that there could be transmission of this COVID-19 from animals to human beings. Absolutely, there is no need to be very panicky. Let them live a comfortable life. Let them strictly follow the whatever the lockdown is actually implemented. Then let them say stay back at home. Then take care of the pets, and then love their animals as they have been doing in the past. And then government should initiate to implement the similar strategy which are being implemented for checking the transmission cycle of virus from human to human spread. Similar strategy and similar say advisories will have to be say to be implemented for animal health sector with a special reference to pet animals.
I think that there's no question about it. But just before we call off, and I wish you a good evening. I want to just please share with us a little bit about what you do. We've been so impressed earlier with the kind of work that you've done specifically in the field of animal rabies and some of
Rabies.
your, yeah. So I know that you're globally well renowned. You've worked all over the world on this. Just a couple of lines on what you do and your area of specialization.
Sure, Mrs. Priya. In fact, I have been working as an associate professor in the Department of Microbiology at Veterinary College, which is affiliated to Karnataka Veterinary Animal Fishery Sciences University.
Yes.
The university is, so this building is located at Hebbal of the International Airport Road in Bangalore itself. So this is actually OIE recognized laboratory. You know, we have World Health Organization, WHO, say headquarters is actually located at Geneva in Switzerland. The equivalent, this WHO takes care of the human health sector. You know, the equivalent international agency for livestock, the animals and the birds is OIE. OIE convention was actually standing from Office of International Epizooties. Now the OIE is actually rechristened as World Organization for Animal Health to make it on par with WHO.
Right.
You know what I mean? The WHO
Yes.
is for human population, the OIE is for animal population.
Right.
And our laboratory is actually having 3 important mandates. This is a dedicated biosafety level 2 lab to conduct the animal rabies related research activities in the Southeast Asian countries itself, not only in the country. And we have been associated with our neighboring countries, and we are involved in training these veterinarians who are actually working on animal rabies in our neighboring countries. It's a special reference to the SAARC countries. And our laboratory is a dedicated biosafety level 2 lab. Other than rabies virus, we don't handle anything. And we have got 3 important mandates in this lab, Mrs. Priya. The number one, we keep receiving brain samples of different species of animals, including wild animals.
Yeah.
And we receive them to look for the presence of rabies viral inclusion in the brain tissue impressions. We receive them from, say, right from Jammu, Kashmir, Assam, and then down so from even from Kerala. And we employ the WHO as well as OIE approved international quality diagnostics. That is the fluorescent microscopy. That is one thing. Then immediately we contact the particular person who would have submitted these brain samples to our lab, because official procedures will have to be followed later. Supposing some individuals are actually bitten by these rabies suspected animals, first of all, saving the human life is important. Then telephonically we tell them whether the animal would have died because of rabies or not. Based on the positivity or negativity, the medical professional can take the decision to continue with the post-exposure prophylactic vaccination in case of human beings.
Got it.
That is our first mandate. Then second mandate, as far as international transportation of pet animals, especially with reference to dogs and cats, we keep receiving huge number of serum samples of pet animals from different parts of the country. And then we test them for serum neutralization by serum neutralization test, where we actually estimate whether the anti-rabies vaccinal antibody titer is sufficient enough to confer protection to these dogs, vaccinated dogs, against rabies or not. Only once we issue this certificate from our laboratory, then only the countries wherever these pet animals are to be taken, they will approve the owners to move their animals into the different countries. Yeah. This is the second mandate. Then third and probably the most important mandate is to generate human resource development in India. So we have been associated with national level training programs, international level training programs for our veterinarians who are working in the field as well as even other sectors, and train them how to collect the brain sample by employing the most simple method. So we have evolved in association with the CDC Atlanta in the United States. We are collaborating with CDC Atlanta in the United States. You know, they are also the major players at the global level as far as COVID-19 virus is also concerned.
Yes.
Then we are also collaborating with APHA. APHA stands for Animal Plant Health Agency, whose headquarters is actually based in Weybridge. Weybridge is about, say, 7 miles southwest of London. We keep going there. They keep coming here. And totally the mandate of this particular OI twinning program with these 2 international agencies is to totally strengthen animal rabies diagnosis in India through such extensive hands-on workshop-based conferences or training programs, especially for veterinarians.
Got it. Got it.
And then we train them how to collect the brain, how to pack, how to ship, how to conduct diagnosis of rabies in the animals, so that they need not have to ship the brain samples all the way from Assam, Jammu, Kashmir, or Guwahati to our lab.
Right.
We are supporting different veterinary institutions in the country, and then we train them, we support them technically, so that they should be self-dependent. So this kind of network we have already developed in India. These are 3 important mandates of our OIE twin lab, and this is ISO 17025 compliant laboratory. This is very recent. I just missed to tell you that last month itself we were given that certification. This is the ISO 17025 2017 version compliant laboratory dedicated for animal rabies research.
Fantastic. No, no, thank you so much. Dr. Isloor, thank you for giving us the background because, as a person who spent so much of time in the space of microbiology in terms of, and epidemics, you have really got an understanding of this. So I think broadly, we've had a great conversation. We've had an understanding of your expertise. But most importantly, I think from a specialist point of view, an expert's point of view, we understand that the current, you know, uh, fears and worries about COVID when it comes to pets is unfounded. We must
Yes,
responsibly address that, and we must take proper steps as the government and pet parents, practitioners, to ensure our pets are safe and to ensure that nobody abandons their pets at this time. So I hope
exactly,
our government also helps
exactly.
us. Yeah. So Dr. Isloor, thank
Very
you
true.
so much. Thank you so much. You have been, as always,
Thank
so
you.
helpful, and I have a feeling we may come back and have another session shortly. So this
Sure,
is our session
anytime.
on COVID and pets.
So
Thank
thank
you
you so
so
much,
much.
Mrs. Priya. Yeah, yeah. Thank you so much. Yeah.
Thank you, and good
Okay.
night.
Thank you. Okay. Good night. Bye.